such a tricky area. And my expertise started in Lyme disease. And I don't even like to just say Lyme disease because truly Lyme disease is Borrelia. It's one area of the infectious protocol of the umbrella. We call it more vector-borne illness because what we know is 98% of my clients who have chronic Lyme disease and co-infections, because the co-infections are the biggest part of it all, have never found a tick on them, ever. So we know through our studies and through our experience through muscle testing that it also can come from spiders, fleas, mosquitoes, different types of insects. And it's those that add up in that cup, the cup analogy over time. Maybe it took someone 6 bites, maybe more, before they started to manifest into a symptom of joint pain, digestive issues, brain fog, you name it. So we're known for it, and it tends to vibrate on the lower side. And when we talk about vibration, we talk about emotional vibration scale at INDRA, and the emotions and the heaviness around Lyme disease are a real thing. It is. A lot of my clients would say, I sometimes wish that it was a diagnosis of cancer because people would pay attention and you would visibly see it. And that's not to discredit cancer or minimize it. Lyme disease is massive and vector-borne illness is massive. And it's almost like a silent epidemic that we have. And we're able to chip away at those layers to bring people relief. And it's also an unlearning process because people will be like, my Lyme disease, my this. So we work very hard at language around emotion and say, maybe it's just, I have symptoms of, and it's not the attachment to who they are, because a lot of times they're clinging to it because that's all they have. It's such a desperation. So we work a lot on empowerment at INDRA, especially in the clinic. It's got this beautiful vibe where I'll deal with the deeper layers of Lyme in my private office because that's my original training. And then they get so much foundational work done in clinic to work on the nervous system, other infections, hormones, emotions, trauma, the brain. And it's got this beautiful, supportive, healing, positive vibe. So you'll see people walking out with their heads a little higher and feeling supported. And because Lyme itself, Lyme and vector-borne illness, co-infections are a real thing. And we've seen it come close to destroying a lot of lives, all ages. It's a very great question. We don't use the word cure because the proof, right? Even the blood work, the testing of it's so inconclusive. Because a lot of times someone could test positive, negative for co-infections of Lyme disease or vector-borne illness, but they feel debilitated. They come to us, we muscle test and find you're loaded. And then by the time we work on the body, and then someone might be curious and go back and do testing and then they flag positive. Well, that happens because the antibodies are now showing. They're out of the depth and they're in the blood now as showing as die-off. And some doctors I've worked with have said they don't even do much testing afterwards to show proof because number one, it could be inaccurate, but number two, antibodies can stay in the blood for up to 20 years. So they've pretty much go, let's make this symptom-based. If you feel better, that's all that matters. That's the number one thing is feeling better. You know, my theory is that when it's been in the body for a long time, a lot of these pathogens, infections are really smart, especially some of these bloodborne parasitic ones. They dig deep into the body so they can hide. They're opportunistic. They go, oh, good. There's a concussion up there. Oh, there's a pacemaker now that most likely the heart went in the first place due to vector Lyme disease. I've got little niches, the bowels. Oh, there's places I can hide in there. They want to stay in a cozy environment. They don't want to be found. So I think it digs deep, my personal opinion, it digs deep into the body. And that's why the testing could be really difficult. Yeah. But we need, people need to start somewhere. If they don't find us, they have to go somewhere. So sometimes the testing is helpful sometimes. It's just not as accurate as we would hope. As far as vector-borne illness or Lyme disease, I believe the CDC says it's got to be about 48 hours of the tick being on the body for it to transmit infection. And what we have found through our muscle testing and through symptoms is that it can take literally 15 seconds. For once the skin is broken, things could start to dump. So that's a whole different arena than we're used to. And we see a lot of that at our clinic and at our space. And there is an infection called rickettsia. And rickettsia is a blood-borne infection that we are now finding that studies show that 85% of people upon autopsy from Alzheimer's or late onset dementia have rickettsia in their bodies. So we wonder, was there mosquito bites? Was there some type of other vector-borne infection put into the body, dumped in, and then transmitted this infection rickettsia that then affected the brain? And now we look at it as Alzheimer's, one of the causes of Alzheimer's and dementia. So we do find that a lot when we're scanning our clients. And we have found in many cases that we are able to start to reverse symptoms or halt or at least maintain the baseline of where they're at if they're progressive with Alzheimer's and dementia. So we have a lot to learn still. We're in an arena where there's so much more growth. And that's why even through INDRA, my protocol, our protocol, it's a living, breathing protocol. It will continue to grow. There's COVID protocols, Lyme protocols, because if we stop in science where we are, we're not going to make progress. We're ever evolving.